everyone. I am Dr. K. Ramalakshmi, Lecturer, Faculty of Physiotherapy, Dr.M.G.R. Educational Research Institute. So today I am going to explain about the bicycle ergometer, which is of a company from Physio Max. The equipment cost around 4 to 4.5 lakhs. So mainly why the bicycle ergometer is used. So this bicycle ergometer has many uses. For example, if you want to check about the cardiovascular endurance of a patient, or we need to train a patient for any further exercises, or we need to strengthen the muscle power of a patient, in variety or in various aspects, this bicycle ergometer can be used. But most commonly in physiotherapy, we use it for to assess the cardiovascular endurance of the patient who is going for any cardiovascular surgeries, or who has already undergone any cardiovascular surgeries for myocardial infarction or any CABG surgeries, or who has planned to go for any cardiovascular surgery. And in other cases, we also measure the cardiovascular fitness for persons who are involved in sports, or who are involved in any other extracurricular activities where the cardiovascular fitness plays a very, very important role. So in those cases, we also check the cardiovascular fitness through bicycle ergometer. So there are other modalities such as treadmill or other scales with which we also can check the cardiovascular fitness, but here we use the bicycle ergometer because it is very comfortable for the person to do the exercises rather than treadmill. Because for running in a treadmill, we need a basic experience, or the persons may have risk of fall. So for everyone, we cannot do the treadmill testing. So in those cases, we can use the bicycle ergometer. And in other cases, like where we need to strengthen the muscle power of the lower limb and the upper limb, that in those cases also we can improve the muscle power and the strength through this bicycle ergometer. So the indications for this bicycle ergometer, first we have this here, we have the upper body and the lower body. So for upper body, we can use the arm ergometer, whereas for the lower body, you can use this that is the leg ergometer. So when comparing the leg ergometer, it is for the persons in whom we need to check only the upper body muscular endurance, or the persons who are unable to use their legs, or they have any injuries in their lower limb. For them, we can check the cardiovascular fitness through this upper body ergometer also. So we can check the muscle strength of all the muscles surrounding our shoulder joint, and also the respiratory fitness also we can check through this upper body ergometer. Usually we can mix both the upper body and the lower body ergometer, and if we need to check in persons in whom we need to check the better cardiovascular fitness, in those persons we can check with both arm and the leg ergometer. So indications, when coming to the indications, the first and foremost, as I told, that patients with recent who has undergone any surgery. So for them, how the surgeries, how the patient is beginning to with their functional capacity. So first and foremost, we need to check the functional capacity of the patient. So in the functional capacity, how we check, that is through this bicycle ergometer. So after a few weeks of the surgeries, we can check how much the patient is able to do, or how much stress the heart can take when doing the exercises. So based on that, we can go for further exercises training, or based on that we can fix, or we can create an exercise protocol for that particular patient. So that is the first indication. The second indication, again, for checking the cardiovascular fitness in persons with sports, in those patients also we can use this bicycle ergometer. And again, in the third case, if we need to strengthen the muscle power of the arm and the leg, in those cases also we can use this bicycle ergometer. And coming to the contraindications, the first and foremost is recent MI, which is not treated till now. Any recent MI the patient has undergone, in those cases we may not do the bicycle ergometer. And in patients with recent aneurysm or fluctuating hemodynamic stages, that is hemodynamic changes vandu proper illa, that is there is problem with their heart rate, or their problem with the blood pressure, or their problem with the respiratory rate, or the problem with its oxygen saturation. In those cases, we should not do the bicycle ergometer. And any fluctuating arrhythmias, irregular arrhythmias, in those cases also we should avoid doing this bicycle ergometer. Next, coming to the procedure, how we will do the bicycle ergometer, how we will start the bicycle ergometer. That is the first and foremost, it is a cycle of around 6 to 12 minutes. So we can do the bicycle ergometer, or we can check or to do a protocol is between 6 to 12 minutes. So in the 6 to 12 minutes, it is divided into 3 minutes, 3 minutes, 3 minutes and 3 minutes. So the first 3 minutes we use it for warm-up phase, and the last 3 minutes we use it for cool down phase. So when coming to the warm-up phase, so in the warm-up phase, we do not give any resistance in the upper limb or the lower limb. We do not give any power. The power kudukamle, we have to just ask the patient to do the rotation. So we have to just ask the patient to do the cycling for the first 3 minutes, and then next after 3 minutes we have to check the patient's heart rate, the patient's the respiratory rate, the patient's blood pressure, and the patient's RPE, that is rate of perceived exertion, through the box dyspnea scale. So RPE, it is very important, and we have to do it at every 3 minutes. So RPE that is the rate of perceived exertion. We can use a box dyspnea scale, and every 3 minutes we have to mark it in the box dyspnea scale. So that is all these hemodynamics, we have to measure it at every 3 minutes. And after 3 minutes, based on the patient's maximal heart rate, that is the patient's target heart rate, that is 220 minus age, that we have to find it out. What is the patient's target heart rate? And based on the patient's target heart rate, we can find the maximum heart rate. That is, the maximum heart rate is how we will measure the maximum heart rate is, it is just the 85% of the patient's maximum, that is the target heart rate. So it is 0.85 into 220 minus age. So this is the formula to calculate the patient's maximal heart rate. So when we have to calculate this, and this should be the heart rate which should not be exceeding when doing the exercises. So in the heart rate, within this heart rate, the patient should do the exercises. It should not go beyond this particular limit of heart rate. And again, after 3 minutes, we have to start with a minimal of 0.5 to 1 kg of weight. We have to give a resistance of 0.5 to 1 kg of weight, and then we have to ask the patient to do the repetitions continuously for 3 minutes. And again, after the 3 minutes, we have to check the heart rate, BP, PRE, that is the rate of perceived exertion. All these we have to check for the patient. And again, after 3 minutes, if the patient needs some rest, we can give the rest period. And after rest period, again we have to check all the hemodynamics ratio. And after that, again we can start with the 3 minutes. So we will get 3 minutes, 3 minutes, 3 minutes, 3 minutes, and the whole the protocol which we have taken for the patient. Depending on this, we will decide whether the patient is how the patient's functional capacity is. So that is how we use this bicycle ergometer. So we have to start first. We have to start with, either we can start with the quick start, or we have other workouts. So if we check the workouts, we have manual, that which we can fix by ourselves. So you have warm-up phase here, you have interval training, you have valley, ramp, mountain, rolling, climbing, random and hill. So at every level, that is here you can see that level, that is level 5, it is used for the cardiorespiratory fitness or to check the cardiorespiratory training. So if we give the level 5 here, then we have to check how we have to check for the cardiorespiratory training. If you are going to give the level of hills or mountains, then we can check it for a cardiorespiratory fitness, that is in persons with sports. And if we just want to work out, that is only we need to strengthen the muscle power of the lower limb and the upper limb, then we can just give the workout, and we have to ask the patient just to do the that is the repetitions for a given particular resistance and for a particular time. So based on this, we can divide divide the test. So we will see it for this thing. I'm just going to give a quick start at the level of 5, that is cardio. So he is going to start. So the time is given as 30 minutes. So he has burned around the calories is not burned till now, 4 nets has been used. Yes, so he's doing the warm-up phase, and after warm-up phase, again we have to check the BP, heart rate in case of a patient. In case of a sports person, it's not necessary to check the heart rate, respiratory rate, or the rate of perceived exertion. That and all, it's not necessary. But in case of a patient who is going for any surgery or who has recently come out of cardiac surgery, in those cases we have to check all the hemodynamics. So in this, he is doing 3 minutes of warm-up, and again we have to increase the weight or the resistance in the leg and in the arm, and then he has to continue it for next 3 minutes, and we will check the respiratory rate, the heart rate, the rate of perceived exertion, and based on that we have to give our values. So this equipment is used in studies for UG students, PG students, and for conducting research activities in our college. And this is the students make use of this, and the cardiovascular fitness and the cardiovascular endurance can be measured using this bicycle ergometer. Thank you.